As the Rhode Island Department of Health says, we are just days away from the first Rhode Islanders receiving vaccine doses. We know many of you still have a lot of questions. So 12 News reporter Courtney Carter took your questions straight to the Department of Health to get some answers. Courtney?
I spoke to Dr. Phillip Chan this afternoon about the vaccine, talking about everything from kids in school to who qualifies to be in what phase. Dr. Phillip Chan, a consultant medical director at the Department of Health, provided Thursday an optimistic look in a 4-phase timeline for the vaccine at the governor's press conference. But many of our viewers still had questions. I took to social media to find out what they had to say and brought the questions straight to the Department of Health. Stefano Delkovich of East Greenwich asks, why are children in phase 3 of the distribution? There are no studies showing they get seriously ill when infected. Should we wait on this for them?
Young children generally do really well. They're not infected as seriously. However, we do believe that children can contribute somewhat to transmission in the community. Obviously, prioritizing K through 12 school is incredibly important.
Tracy Clifford asked, is the projected timeline of when people can get the vaccine only based on projection that we will have Moderna and Pfizer only? Could the timeline change if we get Oxford and Johnson & Johnson too?
So great question. So our current vaccine timelines are based mainly on Pfizer and Moderna. If we have a new vaccine or two that's approved in the coming months, that will greatly help us getting vaccine out. That would change the game, and we're obviously hoping that it happens.
And another viewer asked, people with compromised immune systems, like my son who is 15 and has Crohn's disease, which phase would he be in?
People with comorbid and underlying conditions that put them significantly at risk of severe COVID-19 are being prioritized as part of phase 1B. So the decision of who is significantly at higher risk, that's a decision that people should check in with their medical provider or physician about.
Now, Dr. Chan says the shots will be administered by hospitals, pharmacies, and doctors' offices, but not from the state. I'm Courtney Carter, 12 News.